is Monday morning at Nata Clinic. This is just a typical Monday morning. People are coming in from all over the village with various complaints. Some have coughs, tuberculosis. 40% of this population is HIV/AIDS positive, so a lot of these people are coming in with AIDS-related problems and complaints. We have only one doctor at this clinic, and he has just started this week, so it's been a big relief to have him here. Everybody's queuing up right now. They're queuing up for dispensary to get their medications. They're queuing up to have the children weighed at the back for the Well Baby Clinic. And then we have the mothers that are here with, they call the antenatal clinic, we call it neonatal in the States. But the mothers come in and are HIV tested, and if they are positive, then they are put on AZT at 28 weeks to help prevent the mother-to-child transmission of HIV/AIDS. And this is our nurse, head nurse. This is Oipokila Haukwale. She is a senior nurse here at Nata Clinic, and she is in charge. And she is one of the youngest senior nurses in the country, and I'm very honored and proud to work with her. Yeah. This is our dispensary where the patients get their medications. We're lucky, we have a pretty good stock, but we still run out of some of the highly needed medications. Sometimes we don't even have hydrocortisone cream for skin rashes and skin irritations. We sometimes have a good supply of medicine, but then other times we run out. We've had times where we've run out of formula for the babies, and that was a huge problem because we're asking women to not breastfeed their children when they're HIV positive. But then if we don't have the formula to provide for them, then it puts them in a terrible bind. Right now we're in good shape. We've got a lot of formula and we have a relatively good stock of medication. This is the room for dressing changes. We have all kinds of infections. We do have a problem in this village with people assaulting one another. We have an alcohol problem in this village. People drink too much. They come in having been cut up from one another. Children also, many children fall into the fires. The majority of the people in this village cook over open fire, and often the children will fall in and get burned. The other problem is a lot of the parents are intoxicated and aren't watching the children, and so then they fall victim to the fires. We're going to walk into the waiting area, and this is about the number of people that are waiting every day to see our one doctor. Okay, this is we call it a caravan. This is Keumile Kapandora, the PMTCT lay counselor. Or Nata. And this is where she does her pre and post test counseling. Like, do you have a rapid test here?
Yes, I do.
Could you pull it out and show it to us? Yeah, and do you prick the thumb?
Yes.
Or the finger?
The thumb.
The thumb. Either one. And then where does the blood go on, this one or this one?
Both of them.
Both.
I use two.
You do two. Okay, so just top line is negative, 2 lines is positive.
Yes.
And they can get the results in how long?
In 15 minutes.
15 minutes, okay, I thought it was 10, but 15 minutes and then we know. Are you willing to talk about your treatment with me? Because I know there's confidence, yeah. And so what is your CD4 count?
I don't know now. It was 688.
It was 688. And so you've had a baby, and your baby is negative, and you're on this is a Botswana success story, man. This is a success story. You look so healthy, and your baby's healthy. Ah, that's great. Do you tell all your friends that are having babies to come here?
Yes.
And come and join the PMTCT program?
She does. She brought the whole family, the mother, the father, the brother.
You brought them
and
all
of us.
And
yes.
did you get them everybody tested?
Yes.
So how do you convince people to test for HIV/AIDS?
How
How do you make them come? Because sometimes they say, oh, I'm afraid. They say, oh, I'm afraid. How do you get them to come?
Go and test.
You just tell them,
Go and test.
and then they do.
Just accept the result. If you are negative, you are negative, you are positive, you are given treatment aid. And you can be okay if you take treatment.
Yes.
While the disease is not bad.
It's great. You're great. This woman was pregnant. She came in. She was HIV positive. She signed up for the PMTCD program. She took the medication. She's had a child, and the child has just had it's a complicated name, polymer chain reaction, PCR test. It's a very sensitive test for HIV/AIDS, and her 6-month-old baby is now negative. This is an example of what can happen when programs are put in place and lives can be saved. Rocks.